Hello there, my name is Yudi, and this is the Yudi Factor, a program that understands that knowledge is power. And therefore, week after week, we discuss issues and empower you with information to enable you make informed choices, especially when you factor in something you heard on the Yudi Factor into your situation. Today, we'll be talking about cancer. Our guest is Dr. Abiodun Popola, a consultant oncologist with the Lagos State University College of Medicine, Ikeja. He'll be empowering us with information on cancer. Today, we're going to be taking an overview of what cancer is and why it is so rampant and what we can do or what we shouldn't do. Don't go anywhere. We'll be right back, and you'll get to meet my guests. You're welcome back, Dr. Abiodun. Thank you very much for coming to empower us with information at such short notice.
You're welcome.
Thank you very much. Well, what does an oncologist do? Let's start from there.
An oncologist deals with study and treatment of cancer.
Now, can you tell us how many different cancers do we have in the world?
Well, let me start by defining what cancer is. Okay. Cancer is a group of cells that grows in an uncontrollable manner and is capable of spread to distant organ. And the risk can be divided into two: environmental and genetic. The environmentals involve cultural habit, dietary, and polluant. And also the genetics, as the name implies, is the one that you inherit from your parent. So cancer can affect all parts of the body, any system in the body, be it skin, breast, intestine, bone, etc.
So which means that you cannot tell us definitely we have 20 types of cancer or 30 types of cancer?
No, I can't tell you that, but can affect any part of the body.
Why it looks like it's on the increase? Why? What is it that we're doing now that we're not doing before? What are we doing wrong?
Well, cancer is a health problem worldwide, affecting all categories of person. And the incidence is increasing worldwide, Africa, Nigeria inclusive. This is as a result of aging and population increase. And also is associated with risk factors that is associated with economic situation of the country. For example, a lot of people are smoking now because of maybe buoyancy in the economy, and also because people have changed their dietary habit, and people have also been living a sedentary life, and also exposure to industrial toxin. The country is becoming more industrialized, and there are a lot of waste products that are not properly disposed, and all this constitutes a health hazard, and they can increase the risk of developing cancer.
Is there any tests that one can run? Okay, I know that hereditary is one of them, when you know your parents had cancer before. Is there any test, even if you didn't have cancer in your family, is there any test that one can run early to identify if there's cancer in your genes? And do we have such tests here in Nigeria?
Screening is a form of secondary prevention of cancer, because some cancer have intermediate form that are not full-blown cancer, you can screen for asymptomatic cancer, and you can detect it early and you can eliminate cancer. Let me just tell you a simple example, that of carcinoma of the cervix. It's been found that carcinoma of the cervix is caused by human papilloma virus, which is transmitted sexually. 95 to 100% of cancer patients that have cervical cancer have a DNA of human papilloma virus, which is an infection in them. So what you can do is you can screen as early as 18, between 18 and 21, you can do pap smear. Some doctors do it every 3 years, and you can detect some earliest form of carcinoma of the cervix. They are not yet full blown. We call them CNI 1, 2, 3. If you detect this, you can easily treat this and eliminate it. Other thing you can do is genetic testing, especially for people who have high risk, and who have a family history of cancer. You can do genetic testing, and then you can, for example, Angelina Jolie did genetic testing because the mother had cancer, and she found that she has a form of BRCA 1 or 2 in her system. She went for bilateral mastectomy. That means she has eliminated or reduced the risk of developing breast cancer. But unfortunately, pap smear, we can do it everywhere in the country, but genetic testing cannot be done in Nigeria.
Doc, I know that you have seen a lot of cancer patients.
Yes.
Could you describe what the pain is like? Take, for instance, breast cancer. Let's use that.
Breast cancer is grouped into stage 1, 2, 3, and 4. The early stage is stage 1 and stage 2. But once you get to stage 3 and stage 4, it can only be, the only form of treatment you can have is palliative treatment, cannot be cured. And this set of people have spread to bone, to lungs, especially when it's stage 4, to bone, to lung, to brain, and they experience a lot of pain.
Hold the thought, doctor. Hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, I have Dr. Abiodun Apopola, a consultant oncologist with the Lagos State University College of Medicine, Ikeja, talking to us about cancer. So, Doc, I was asking you, and you were telling us about the different stages and the stages where the treatment will just be palliative. And I ask you again, when they get to this 3rd and 4th stage, what is it like?
Those that have the cancer in their bone have excruciating pain, in which you start giving them copious analgesic. The highest level of analgesic that we have in the country is morphine. But when this cannot take care of it, you do what we call palliative radiotherapy to destroy the cancer cell in the bone and also to prevent the bone from being fractured. Then if there's spread to the lung, the patient will be uncomfortable, won't be able to breathe well, will be having pain, and will be coughing. So it's a terrible thing. Until when you drain the fluid in the lung, you give chemotherapy, to reduce the cancer cells in the lung and also all over the body. So it's a terrible thing that drains them emotionally and also drains them financially.
Doc, what kind of lifestyle do you think the ones who don't have cancer can adopt? What kind of lifestyle, both in dietary and in what kind of lifestyle?
This is a very important question because prevention is better than cure. There are 3 levels of prevention that we have. We have primary, we have secondary, and we have tertiary prevention. Primary prevention involves intervention or modification of the environmental, genetic, and biological factors that are found in the causal pathway of carcinogenesis. What I mean by carcinogenesis is that the process of developing cancer. Simply is elimination or reduction of exposure to those things that can increase the risk of cancer. The first one that I mentioned is tobacco smoke. Tobacco smoke is so dangerous that it affects or is associated with all forms of cancer, be it lung, be it laryngeal cancer, larynx, that's the voice box, the nasopharynx, breast, and name it. So if you educate people on the danger of cigarettes and they reduce, this can reduce the incidence of this can reduce the incidence of various forms of cancer. Then those who are already smoking, if you arrange a cessation program for them, and then if you increase the cost of tobacco by way of tax, and also it may deter some people. Then also if you ban the advertisement of tobacco, it can reduce their level of exposure to tobacco. The other one is vaccination. Carcinoma of cervix, I said earlier, is caused by human papilloma virus. 95 to 100% of human papilloma virus is found in the DNA of tissue. In the tissue obtained from carcinoma of the cervix. So if you vaccinate young girls and boys between the age of 11 and 12, it will reduce the incidence. And also multiple sexual partner, if you cut it off, because the only way through which human papilloma virus is being transmitted is through multiple sexual partner from one person to the other. Then hepatitis B is also a constitutive factor in liver cancer. You can give vaccination for hepatitis B, and you can also teach people how to avoid exposure to aflatoxin, which is also a factor in liver cancer. And also people should not live a sedentary life, to exercise themselves and to eat healthy. So these are just a few examples of.
Now, somebody will tell you, because you find out that a lot of people, even though government has done everything about tobacco, they still enjoy smoking tobacco. So those ones are the ones actually causing it for themselves. Somebody will say, look, I have done all this. There are people I know who don't smoke, who don't drink, who don't, and they still end up with cancer. What do you say about that?
The only thing they can do is screening to detect this cancer on time at the earliest stage so as to prevent it. Because if you detect cancer early and you go for treatment, you are going to survive. It's curable.
There are some cancers that are very common.
Yes.
There's the breast cancer, prostate cancer, the
cervical
cervical cancer that we hear very often. So I want you to take time to just give us the earliest warning signs that these things could be lurking around the corner.
Okay.
Take for instance, prostate cancer.
Yeah.
Does it have to do with age,
Yes.
or does it have to do with lifestyle?
I'm going to talk on one in the female and one in the male.
Okay.
Prostate is the one that is very common in male. The risk of developing prostate cancer is associated with increased age. As you are aging, then you know that you can develop prostate cancer. It usually occurs after the age of 65. It usually occurs. It can be found, it has been found below 60.
Hold that thought, doctor. Hold that thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, my guest is still Dr. Abiodun Popola, the consultant oncologist with the Lagos State University College of Medicine, Ikeja. And right now, in this remaining moments, he's going to be talking to us about the earliest subtle warning signs of prostate cancer and breast cancer. You're welcome. So
as I was saying, prostate cancer is one of the commonest cancer in men, and is associated with as you advance in age, you can develop prostate cancer. So there's a screening program for prostate cancer. We call it, you go and do your prostate-specific antigen. They take your blood yearly, and you do it as from the age of 40. So the normal is 0 to 4 nanogram per liter, but also depend on the age. Yes. So anything that is different from this value, you can, your doctor, you need to take it to your doctor, and they will do further examination. So with this, you can catch or you can detect prostate cancer early.
Isn't there any sign like maybe coughing or this kind
By the time the patient starts coughing, or by the time you start having pain, or by the time you start having problem in passing urine, blocking your urinary outlet, then it's advanced. So it's advanced. So for breast cancer, any lump, if you detect any lump in your breast, and that's why we always advise women to check their breast, or their spouse to check it regularly for them. When you detect any lump, no matter how small it is, then you take it, you go to the hospital for clinical breast examination. What I described earlier is self-breast examination. Once you detect anything, you go to the doctor, they do clinical breast examination for you. And if you are below the age of 40, they can send you for ultrasound to really outline the tumor and the location, the size. But if you are more than, and your age is above 40, you are entitled to do mammogram, yearly mammogram, to screen yourself from breast cancer. But the earliest symptom is a lump, painless lump, or in some people, they have bloody discharge from the nipple. Bloody discharge from the nipple. Those are the earliest signs. But as the tumor grows, it can be associated with pain, it can be associated with a distortion of the breast, or distortion of the nipple, or there will be increase in the size of the breast compared to the other one. And as it advances, it spreads to the bone, to the lungs, and to the brain, or to the liver, in which the patient's eye become yellow. The patient start coughing, and the patient start having pain all over the body. But those are advanced stage.
Once you say you have cancer, people always pencil you down to die. So I ask you, is having cancer a death sentence?
Having cancer is not a death sentence. We said it over and over again. if you detect cancer early stage cancer can be cured, and the patient is going to survive. But if you delay, the cancer keep on growing and keep on advancing, and then there's nothing much anybody can do. There are so many factors that makes people run away from treatment, or once they are diagnosed as having cancer. Maybe finance, it may be the psychological effect, maybe some myths associated with cancer in our environment. It can also be the cost of treatment, or ignorance on how to go about the treatment.
Some people believe that cancer is a spiritual thing. So what do you say to that?
I think we should begin to disabuse the mind of our people that cancer is a spiritual thing. Everything that happens in the universe is spiritual. Yeah. And each one of us have a different way in which we worship our God. And God gave doctors wisdom. It's God that created heaven and earth.
That is true.
That gave doctors wisdom.
True.
So go to church, pray, and let doctors
do their
work. So nobody's asking you not to go and pray, but please do whatever the doctor asks you to do on time. Don't go to those spiritualists in quote that they will say they are going to suck it out and they are going to cure you immediately. We've seen a lot in our center. After going round and round, they will still come back, but they will have moved from stage 1, stage 2 to stage 4, in which the doctor cannot do anything. Don't run away from the hospital because of surgery. Seek government support and your church support in the treatment.
Doc, we've heard of cancer in children too. What do you think are the causes of cancer in children?
It's genetics. They inherit it. The gene they inherit, or mutation from their parents, causes cancer in children. Mainly, most of their cancer are due to genetic alteration.
What would you say about chemotherapy?
Chemotherapy and cytotoxic drugs that kill cancer. Mm-hmm. They kill cancer because of the characteristics of cancer cells, mm-hmm. as compared to that of a normal cell in the body. Okay. Cancer cells divide rapidly as compared to normal cells. That's the way I will be able to explain it so that people will know. They divide rapidly, whereas, and they've lost control in their replication, in their division, whereas there are a lot of control for normal cells. So, because of this property, cytotoxic drug, chemotherapy, target and kill cancer cells as compared to normal cells. However, there are some cells in the body that divide rapidly, and that's why they have side effects. For example, the hair follicles, the lining of our intestine, our gut, they divide rapidly, and also the blood lining, they divide rapidly. And that is why if you give chemotherapy, people tend to vomit or have diarrhea, frequent watery stool, because of this property of the intestinal lining. Yes. And that's why they lose hair. But there are drugs that we give to suppress or to minimize this effect. So, but the gain they are going to get from chemotherapy outweigh this side effect. So I will encourage the person to continue to take the chemotherapy. It's just over 5 months. And once you stop, all these side effects will reverse, but the cancer will have been destroyed. That's the beauty.
Okay. If somebody comes to you, you've run tests, and they discover you want to break the news to the person.
I will encourage the person that that's not the end of life. And I will give the person, I will show the person, or I will tell the person so many examples of people who are living for 18 years, who are living for 20 years, that will manage, or that some other colleague have managed. The most important thing is adhere to all types of treatment and encourage the patient.
Thank you very much, doctor. Thank you. Thank you. I really appreciate this. And please, any follow-up from this, I'll invite you to come and empower us with more information.
You're welcome.
And I'll also love to have you back so that you talk to us about specific cancers, especially the most common ones. Thank you.
Thank you,
I'm
ma'am.
humbled. Cancer is not a death sentence. Go out there, get your test done, and once you've been diagnosed early and treated, you'll go ahead to live a normal life and fulfill God's purpose for your life. Until I come your way another time, my name is Yudi, and this is My Factor. Goodbye, and God bless.